Scurvy is a disease resulting from a deficiency of vitamin C. Humans and certain animals require vitamin C in their diets for the synthesis of collagen. In infants, scurvy is sometimes referred to as Barlow's disease, named after Sir Thomas Barlow, a British physician who described it in 1883. However, Barlow's disease may also refer to mitral valve prolapse. Other eponyms for scurvy include Moeller's disease and Cheadle's disease. The chemical name for vitamin C, ascorbic acid, is derived from the Latin name of scurvy, scorbutus, which also provides the adjective scorbutic. Typical symptoms of scurvy are initially fatigue, followed by formation of spots on the skin, spongy gums, and bleeding from the mucous membranes. Spots are most abundant on the thighs and legs, and a person may look pale, feel depressed, and be partially immobilized. As scurvy advances, there can be open, suppurating wounds, loss of teeth, yellow skin, fever, neuropathy, and finally death from bleeding. Treatment is by a vitamin C-rich diet, whereby complete recovery from incipient scurvy takes less than 2 weeks. Vitamin C is widespread in plant tissues, with particularly high concentrations occurring in capsicum fruit, cruciferous vegetables, and citrus fruits. Organ meats such as liver contain more vitamin C than muscle meat. Cooking significantly reduces the concentration of vitamin C, as does exposure to air and copper and other transition metal salts such as those of iron. Scurvy does not occur in most animals as they can synthesize their own vitamin C. However, humans and other higher primates, guinea pigs, most or all bats, and some species of birds and fish lack an enzyme necessary for such synthesis and must obtain vitamin C through their diets. Historically, Hippocrates described scurvy, and herbal cures for scurvy have been known in many native cultures since prehistory. Nevertheless, treatment was inconsistent, and scurvy was one of the limiting factors of marine travel, often killing large numbers of the passengers and crew on long-distance voyages. It was a Scottish surgeon in the Royal Navy, James Lind, who first proved it could be treated with citrus fruit in experiments he described in his 1753 book A Treatise of the Scurvy. Though following a failed trial with extracted lime juice, it would be 40 years before effective prevention based on fresh produce became widespread. Scurvy remained a problem during expeditions and in wartime until the mid-20th century. Signs and symptoms. Early symptoms are malaise and lethargy. Even earlier might be a pain in a section of the gums which interferes with digestion. After 1 to 3 months, patients develop shortness of breath and bone pain. Myalgias may occur because of reduced carnitine production. Other symptoms include skin changes with roughness, easy bruising and peachy gum disease, loosening of teeth, poor wound healing, and emotional changes. Dry mouth and dry eyes similar to Sjogren's syndrome may occur. In the late stages, jaundice, generalized edema, oliguria, neuropathy, fever, convulsions, and eventual death are frequently seen. Cause. Scurvy or subclinical scurvy is caused by the lack of vitamin C. In modern Western societies, scurvy is rarely present in adults, although infants and elderly people are affected. Vitamin C is destroyed by the process of pasteurization, so babies fed with ordinary bottled milk sometimes suffer from scurvy if they are not provided with adequate vitamin supplements. Virtually all commercially available baby formulas contain added vitamin C for this reason, but heat and storage destroy vitamin C. Human breast milk contains sufficient vitamin C, if the mother has an adequate intake. Scurvy is one of the accompanying diseases of malnutrition and thus is still widespread in areas of the world depending on external food aid. Though rare, there are also documented cases of scurvy due to poor dietary choices by people living in industrialized nations. Pathogenesis. Ascorbic acid is needed for a variety of biosynthetic pathways, by accelerating hydroxylation and amidation reactions. In the synthesis of collagen, ascorbic acid is required as a cofactor for prolyl hydroxylase and lysyl hydroxylase. These two enzymes are responsible for the hydroxylation of the proline and lysine amino acids in collagen. Hydroxyproline and hydroxylysine are important for stabilizing collagen by cross-linking the propeptides in collagen. Defective collagen fibrillogenesis impairs wound healing. Collagen is an important part of bone, so bone formation is affected. Defective connective tissue leads to fragile capillaries, resulting in abnormal bleeding. Prevention. Scurvy can be prevented by a diet that includes vitamin C-rich foods such as sweet peppers, guava, black currants, parsley, broccoli, and kiwi fruit. Other sources rich in vitamin C are fruits such as papaya, strawberries and oranges or lemons. It is also found in vegetables, such as Brussels sprouts, cabbage, spinach, and potatoes. Some fruits and vegetables not high in vitamin C may be pickled in lemon juice, which is high in vitamin C, though redundant in the presence of a balanced diet. Various nutritional supplements are available that provide ascorbic acid well in excess of that required to prevent scurvy. Some animal products, including liver, muktuk, oysters, and parts of the central nervous system, including the brain, spinal cord, and adrenal medulla, contain large amounts of vitamin C, and can even be used to treat scurvy. Fresh meat from animals which make their own vitamin C contains enough vitamin C to prevent scurvy, and even partly treat it. In some cases, it was discovered that meat alone, even partly cooked meat, could alleviate scurvy. In other cases, a meat-only diet could cause scurvy. Treatment. Scurvy can be treated by eating vitamin C-rich foods such as fresh sweet peppers, kiwi fruit and broccoli. Scott's 1902 expedition used lightly fried seal meat and liver, whereby complete recovery from incipient scurvy was reported to take less than 2 weeks. Prognosis. Untreated scurvy is invariably fatal. However, death from scurvy is rare in modern times. Since all that is required for a full recovery is the resumption of normal vitamin C intake, it is easy to treat if identified correctly. Evolutionary history. Scurvy does not occur in most animals as they can synthesize their own vitamin C. However, humans and other higher primates, guinea pigs, most or all bats, and some species of birds and fish lack an enzyme necessary for such synthesis and must obtain vitamin C through their diet. The gene for L-gulonolactone oxidase is still present in the human genome, but deactivated by DNA mutations.